Southwest Medical, the sponsor of this next segment, is home to many of our local hospice care heroes. Rocky spoke to a doctor about the hospice services they provide and addresses the questions people frequently ask.
You always have such great information about hospice care with Southwest Medical. We're kind of debunking the myths and also telling the truth about it. So let's just start with, what is hospice care? Let's define it for people.
So hospice care is a level of care that's really appropriate when patients have a life-limiting illness where there are no more curative options and the patient and their family choose to embrace the time that they have, and instead of spending that time pursuing a cure and visiting doctors, they do whatever they want to do, and we support them in that. And we bring the care to their home on their schedule.
The question is now, let's get into these frequently asked questions. Is hospice a place that people must go?
So hospice is absolutely not a place. Hospice is a level of care and service that people have to be eligible for. And something like 98% of our patients are cared for in their home or wherever they were living before hospice started. So if they're in a group home or in assisted living or in an apartment, wherever they live, there are different levels of care within hospice. So sometimes a patient may have unmanaged symptoms that qualify them to go to an inpatient unit for short-term care. So hospice is never supposed to provide the place to live, and we never make patients leave their home.
Is hospice care expensive?
So hospice care is covered by Medicare and Medicaid and just about every commercial insurance. So for most patients, there's not Medicare and Medicaid, there's no copay. Most commercial insurances, there's no copay. Hospice is basically free to the patient, and Medicare and Medicaid pay the hospice for the care that's provided.
How long can someone be in hospice care?
So the criteria for hospice care are on paper, if you will, at Medicare. It says that an individual will have a prognosis of 6 months or fewer. So they're not expected to live longer than 6 months. We have had patients in hospice care for 4 years. Hospice does not put an expiration date on the patient or the service. We just recertify the patient and we go out and make sure they're still eligible for the care.
Beautiful service. And is hospice just medication? Is a frequently asked question.
So hospice is not just medication. So hospices are responsible for providing all of the medications, even a little bit related to the patient's what we call terminal diagnosis, and also all of their medications that are for comfort. So an antidepressant or pain medicine or nausea medicine. But we also provide, and I would say this is more important than the medicine, we provide the nurses and the doctors and the social workers and the chaplains and a bereavement service. So we provide people to help the patient and their family understand what's happening and not be afraid of it.
We want to thank Southwest Medical for sponsoring this segment. They serve all across southern Nevada, and if you want more information, you can call that number, 702-877-5199, or visit their website at smalv.com. We'll be right back.